Okay.
Hi Melissa, my name's Kara. I'm going to do your physical assessment today, okay? First thing I'm going to do is get a set of vitals on you. Go ahead and you can hold them. First thing I'm going to do is grab your radial pulse, and I'm going to just check it as I pump this up. Okay, and I lose it at 100. I am going to check your pulse right now. We will count it for a full minute. And it's 72, and respirations. Are 16. Okay. Okay. 138 over 70. That's good. Good. No fever. That's good. Now, I'm going to tell you everything that I'm doing as I do it, okay? The first thing I'm going to do is I'm just going to take a look at your skin, okay? Your skin is pink, it's tan pigmented, there are macules spread across your face and across your shoulders and your arms in the form of freckles, probably from being out in the sun. Same thing, there's a couple freckles on your legs. There is no evidence of varicosities or edema. Now I'm just going to touch your skin. Your skin is smooth, it's symmetrical, good. And it's not diaphoretic, it's warm, and it's dry. Good. You have female distribution hair across your arms. No hair on your legs. Do you shave your legs?
Mm-hmm.
Good. There's no folliculitis noted. I'm going to test your skin turgor. And that's within normal limits, which means that you are well hydrated. Next thing I'm going to do is I'm going to look at your nails. Your nails are short, they're clean, they're pink undertones. There's no evidence of opacities or ridging. I'm going to look at your toes. Your toes are painted, but they, the nails are well adhered to the nail bed, both in your feet and in your hands. The nail angle is 160 degrees. Can you do this with your fingers? Good. And then with your thumb. Good. There's no evidence of clubbing noted. The next thing I'm going to look at is your hair. Can I have you take off your sunglasses off your head? Thank you. Your hair is shorter, it's brown, it's thick, it's coarse, it's well hydrated, it's clean. And it's got some color in it, some highlights. Now I'm going to touch your hair, and on palpation it's clean, it's full, it's coarse, it's thick. There is no evidence of any infestations or alopecia. Normal female distribution. Your scalp is freely movable. There's no signs of crepitus. Do you have any tenderness when I push on your scalp? No? Good. Good. The next thing I'm going to do is I'm going to look at your head. Your head is normal cephalic. It is upright. It is midline. There are no signs of tics or involuntary movements. I'm just going to put my hands here. Can you open your jaw? Can you clench your jaw? Can you open your jaw and move it side to side? Good. Can you jut it out? Good. And then I want you to try jutting it out with my resistance. Good. The TMJ is felt, but there's no clicks or pops noted. The next thing I'm going to do is feel your paranasal sinuses. Any pain when I push on those? Good. The next thing I'm going to do is I'm going to test your trigeminal number 5 nerve. and that's soft and sharp. So I'm going to have you close your eyes, and you're going to tell me if it's soft or sharp.
Soft. Good. Soft. 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 Hard. Hard.
Good. The next thing I'm going to do is corneal nerve number 7, which is facial gymnastics. So I want you to smile without showing your teeth. I want you to smile showing your teeth. I want you to pout. I want you to purse your lips. I want you to puff your cheeks out. I want you to put your tongue in your cheek. Good. I want you to close your eyes and raise your eyebrows. And then I want you to try to open your eyes with me pushing on them. Good. Good, good, good. Next thing I'm going to do is I am going to feel your lymph nodes. These are preauricle, postauricle, occipital, carotid, submandibular, sublingual, submental, deep, anterior cervical, posterior cervical, and subclavicular. And I was unable to feel any of those, so that's good. Your neck next. Your neck is straight, it's midline. There's no evidence of swelling, no evidence of lesions on the neck. Can I have you swallow? Good. The trachea remains midline. I'm going to feel, I can feel your hyoid bone, and I can feel your cartilage. Can I have you swallow again? Good. The hyoid bone and the cartilage move with swallowing, which is good. That's normal. I cannot inspect your thyroid on inspection, which is good. We don't want to see it. But I am going to have you come this way. Can you step off for me? And I'm going to feel your thyroid. So I want you to swallow again for me. Good. I want you to put your head kind of down and then turn it to the right. Kind of, yeah. And I'm going to just try to palpate. Good. Now turn it to the other side, this way. Good. Good. Your palpate, I can palpate the thyroid. It is movable and smooth, but it's not enlarged. The next thing I'm going to do is cranial nerve number 11, which is strength. I want you to try to shrug your shoulders with my resistance. Good. And then I want you to try to push your head against my hand. Good. And then the other side. Good. Got good strength in your muscles. Go ahead and sit back down. The next thing I'm going to look at is your eyebrows. Your eyebrows are thick, they're full, they're symmetrical, they come out past the outer canthus of the eye. Your eyelashes are brown, they're thick, and they come outward, which is good. I'm going to look at your eye. The papular fissures are distinct. Your irises are brown bilaterally. Your pupils are round and equal. Your cornea is clear. Your conjunctiva is pink, and there are a few vessels noted. There is no ptosis of your eye or lid lagging. I'm going to have you close your eyes. I'm going to palpate your lacrimal ducts and sacs. Any pain when I do that? Good. I'm going to do a few tests on your eyes. The test that we've done earlier is the Snellen test, which is distant vision. We've also done the Rosenbaum test, which is near vision. We would hold a card 14 inches in front of your face. We would check it uncorrected first and then correct it if needed. I am going to take a look at your pupils here, so I just want you to stare past my shoulder. Good. And I want you to follow my pen light with just your eyes. Good. Your pupils are equally reactive to light, accommodation, and consensual. We're going to do cranial nerve number 3, 4, and 6. And those are the ocular motor, the trochanter, and the abducens. And what we're going to do is I'm going to have you follow my pen light with just your eyes. Good. You don't have any sustained nystagmus, so that is good. I'm going to have you do the confrontation test. I want you to cover this eye with your hand. This is the bunny. I want you to tell me when you see the bunny, okay?
No. 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 No.
Good. Now keep that eye covered. We're going to do it on this side.
No. No. No.
Good. We would do that test bilaterally. And the next test that we're going to do is I'm going to have you cover your right eye. And I'm going to have you look to the left with your other eye. Keep looking, and then take your hand off. And both eyes gaze over to that side, which is normal. Now I'm going to look into your eye with the ophthalmoscope. The first thing I would do is I would turn the lights off and I would stand back and I would look for the red reflex. Okay, so what I see in your eye is I see the fundus, which is a creamy yellow. It's full of vessels. There's arterioles and venules. The arterioles are brighter and they're at a 3:5 ratio. There is no evidence of venous nicking or clubbing. And then we look at the optic disc, which is 5 millimeters diameter, and it has no evidence of glaucoma or physiological clubbing. The macula densa is next, and that is a cloudy gray, and it's non-vascular. And then the fovea centralis is a small white thing that we see, and that is the center of your vision. Okay, and there are no hemorrhages in your eyes and no signs of infection, so that is good. The next thing that I'm going to look at is your ears. So your ears are placed bilaterally, symmetrically on your head. They do not appear to be red, swollen, have any lesions on them. You do have piercings in your ears. The top of the helix is coming out and matching up with the outer canthus of your eye. Your ears recoil nicely. I don't see any drainage coming from the ears. So I am going to look at your ears with the ophthalmoscope. The external part of your ear canal, I can see some mild cerumen and some hair. And then when I look at the tympanic membrane, it is a pearly gray. There's no evidence of bulging. There's no evidence of any infection. I can see the bones, which are the umbum, the malleus, the pars tenos, and the pars flaccida. I can see the cone of light. It's at 5 o'clock in the right ear and 7 o'clock in the left ear. Now I am going to do a whisper test. I want you to go ahead and cover your ear, and I'm going to whisper something in your ear. Now, did you hear me?
Yes.
Can you say it?
It's warm out.
Very good. I am also going to test doing the Weber test. I'm going to make this kind of vibrate. I'm going to put it on the top of your head, and I want you to tell me if you hear it in the right ear, the left ear, or both ears bilaterally.
Left.
You hear it in the left more than in the right?
Mhm.
Okay.
Left. Left.
Usually you hear it bilaterally, but that's okay. Okay, the next thing I'm going to do is I'm going to put it, do you have any pain in the mastoid process here?
No.
Good. What we're going to do is we're going to check the vibrations on this. I'm going to put it on the mastoid process. You tell me when you stop hearing it, and then we're going to put it in front of your ear, and then you tell me when you stop, okay? Can you feel the vibration?
Mm-hmm.
So tell me when you don't hear it anymore. Or feel it.
No.
Can you still hear it?
Yes.
Tell me when you stop.
No.
Okay, that is the Rhine test, and what we're looking is for bone to air conduction, and you're going to have a 2-to-1 ratio on that. You're going to hear it longer in the air. Okay, and then after that, we're going to check out your nose. Your nose is symmetrically placed on your nose. It's an appropriate size for your face. You've got a little bit, just a couple little macules, probably from being out in the sun. It is smooth. It does not look swollen. Do you have any pain when I push on your nose?
No.
Good. I'm going to take a peek. I can see bilaterally that your nares are patent. I can see the inferior turbinates. I can see that the mucosa is pink and moist and there are no foreign bodies present. The caramella is midline. The septum is centered. There's no signs of perforation or deviation. We are going to do, can I have you block one nostril and take a deep breath in? Okay, block the other nostril and take a deep, and yep, let that one go. Good. And then I'm going to have you close your eyes and do the smell test. What do you smell?
Vinegar.
Vinegar, very good. And what do you smell here?
Cinnamon.
Cinnamon. Good job. And then I'm going to look at your mouth. Your lips have a distinct vermilion border. They're pink, they're moist, they're not chapped. I am going to have you smile and show me your teeth. Good, your teeth are clean and they're white, and I'm going to have you open up because I'm going to count your teeth. Go ahead, stick your tongue back in. 1, 2, 3, 4, 5, 6, 7, 8. You have 28 teeth. I don't see any signs of dental caries. I'm going to have you open up and say ah. Say ah. Good. The uvula goes up and down. The soft palate goes up and down, and that's all signs that your cranial nerve 9 and 10, which have to do with swallow, speech, gag, reflex, are all working well. I'm going to have you do it again one more time. Good. I can see your tonsils, and they are pink. They're not enlarged, and there's no signs of infection. Your gums are, let me see your gums. Yes, they're pink, they're firm, they're not receding from the gums, which is a good sign. I'm going to just put some gloves on here a second. And I'm going to just look in your mouth, and I can see that underneath your tongue is well vasculated. I can see your sublingual frenulum. I can see your superior frenulum and inferior frenulum are all intact. I can see that the Whartons and Stensons are intact, and that's what secretes your saliva. I can see that your buccal mucosal is pink. There is no signs of ulcerations or eviscerations. Everything looks good here. And your soft and hard palate are intact. Can I have you stick your tongue out? Your tongue is well papilled on the top, on the sides. They're smooth. Can I have you move your tongue up and down and around? And that is cranial nerve number 12, which is the hypoglossal. So everything looks good. The only thing that I was going to do was I was going to listen to your carotid and your thyroid, and we're listening for bruits. Okay, so I'm just going to take a listen here, and I'm going to have you hold your breath. Good, I do not hear any bruits over here. And I do not hear any bruits over here. So everything seems to be good. I just want to thank you for allowing me to do your physical exam. Okay?